All right, let's keep rolling. So let's see. What can you do for my knee pain? I was diagnosed with arthritis about 2 years ago. We get some version of this question all the time. We get like, hey, I got arthritis in my back. They said there's nothing I can do about it. I just have to deal with it. That first of all, that's almost never the case with any pain, with any problem, with any issue. You just having to deal with pain is never the right answer. So if somebody tells you that, they're full of it. There is always something you can do to get some version of better. Is that 10%? Is that 100%? That depends, but you can always make it better. And we get that question with knee arthritis. So I'm going to show y'all a little kind of snippet of at least one part of the treatment. When we're treating, let me see if I know how to do this. Okay, beautiful. So when we're treating pain, when we're treating a problem, we want to treat the physical, we want to treat the chemical environment in that area. And so what we'll use in a lot of cases is something called medical dry needling. And that's what you're seeing here. So this is treating these specific spots around the knee. So, and then you'll see kind of what we're doing is sending a stimulation signal through the joint. So these are actually connected here. These are connected here. These are connected here. So we're running this signal through that joint so that we can get some changes to the subchondral bone. We can actually heal those subchondral surfaces and get a lot of periarticular blood flow. All that means is blood flow in and around the joint so that the capsule gets better nutrients in there. The other thing that happens when we do this for arthritis specifically is we improve the synovial fluid, the fluid inside your knee. When you wake up and your knee is real stiff and your knee's not moving real well, that's because the fluid in there has gotten real thick. It's like molasses feeling. When we do these treatments and we do them consecutively, we can get that fluid in there to where it's moving much, much smoother, where it's nice. It's really, really soft fluid. It's not that kind of stiff and achy feeling when you're moving it. So when we look at a treatment like this, we really can make a lot of changes to knee arthritis. And when we catch it early, that subchondral bone, those subchondral surfaces can heal a lot. So in those instances, we get people with knee arthritis who are starting to see the changes, the alignment changes. And when we combine something like this with all of the hands-on stuff to correct the joint alignment, and we start to correct above, let's make sure that your hip is firing and can strengthen so it keeps your knee aligned. Let me do this. So it keeps your knee aligned, and then we actually fix anything at the feet that would cause you to start falling in and put extra pressure on the knee. In those instances, you're pain-free. Now, how much has the subchondral bone healed? How much has happened to change at that joint surface? We see a lot of improvements in those. And I'd say mild to moderate knee arthritis, we can get you pain-free and you'll feel great. And you're walking and jogging and moving around and doing everything you need to do. Severe arthritis starts to get, what is our expectations and what is reality? That gets a little bit tougher, but we still see, again, improvements. Always can get improvements whenever we're dealing with this stuff. We do a treatment like this, like if people are coming in, and they've had a ligament sprain, if they've had a meniscus irritation, we still want a lot of those changes. So we'll do some similar things, change a little bit, but we'll do some version of a knee treatment. Yes. We'll do some version of a knee treatment like this in most of those knee cases. So hopefully that helps. There's a lot that can be done for arthritis. There's a lot that can be done for meniscus irritations if you're dealing with knees. Post ACL repairs, if you're having trouble recovering, that 6 months out, you really can get a lot of improvements doing some of these things. We get a lot of people who went through a post ACL rehab program and say, hey, it's still not there, or a post knee operation, total knee replacement. And then we start doing some of these things, and even though it's a year or two out, they get all their pain resolved. So you really can do a lot of benefits through some of these treatments. So hopefully that helps. Call us if you have any questions about that. If you want to pop in and talk, we've got some absolutely the best. We've got some amazing therapists here. They'll sit and talk with you and chat about all of that stuff and answer whatever questions you have. So this is work, Patrick. This is work, buddy. I'm trying to get that information. There's so much negative and bad health information out there.